Good afternoon. It's Dr. Adamson coming to you from Cardiology First Clinic in Cibolo, Texas. I'm coming to speak to you about another important cardiology topic today. That topic will be atrial fibrillation. Atrial fibrillation is pretty common. Most of you all probably know someone who has atrial fibrillation, but you just don't know that they have atrial fibrillation. Atrial fibrillation, for the most part, affects people's lives in multiple different ways. It impairs their ability to exercise, sleep, and do multiple other things. Atrial fibrillation specifically is an irregular rhythm. I'll say that again, an irregular rhythm that is due to chaotic, disordered electrical activity in the left and right atrium. It's one of the most prevalent heart arrhythmias, affecting more than 3 to 6 million people. And it's also one of the leading causes of stroke, which is why it's on my radar. It occurs due to direct atrial trauma from scar formation, which causes electrical activity to become disordered. Well, how does a person even know they have atrial fibrillation? Well, a lot of times patients are asymptomatic. They don't feel anything. Some individuals complain of fatigue, shortness of breath, chest pain, low blood pressure, lower extremity edema, and heart failure symptoms. Those heart failure symptoms can be things like difficulty laying down flat in the bed when you're sleeping, swollen legs, decreased ability to walk and exert oneself. So what are the most common causes of atrial fibrillation? Well, the most common cause is hypertension, and that's from high blood pressure. How does high blood pressure cause atrial fibrillation? Well, it causes a stretch on the atrium. That stretch is due to increased pressure, which leads to scarring of the left atrium, which becomes the nidus for atrial fibrillation. Myocardial infarction or heart attacks is another one. Diabetes is running rampant in America and is also a major cause. Lung disease, so those individuals that smoke or have COPD, the back pressure from the lung actually causes the heart to stretch, specifically the right side, leading to atrial fibrillation. Heart failure due to increased fluid can cause the heart to once again to stretch and cause atrial fibrillation. Obstructive sleep apnea that's not treated, once again, the lungs causing increased pressure in the heart, leading to atrial fibrillation. Alcohol is directly toxic to the heart. I've seen individuals who drank large amounts of alcohol develop atrial fibrillation, and when they stopped, the atrial fibrillation resolved. And then medications. Many of our medications are also atrial fibrillation causing agents, and we need to screen for those vigorously. So what are the goals of atrial fibrillation treatment? The first goal is to prevent stroke. The second goal is to restore sinus rhythm. What are the ways that we can prevent stroke? One of those ways is by restoring sinus rhythm. We do that through electrical cardioversion, where we directly electrocute the heart, putting electricity where it needs to be at a certain specific time, which causes a resetting of the heart rhythm. Medications is another one that also helps maintain sinus rhythm and prevent stroke. So if we can keep patients in sinus rhythm and not in atrial fibrillation, they can't have a stroke. The second way is blood thinning medications, such as warfarin or Coumadin. These are the most common and the oldest forms of blood thinning medications. Newer ones are dabigatran, Xarelto, or Eliquis. And left atrial appendage closure devices, such as the Watchman, which is a more advanced topic that we can talk about at another time. So, as I briefly discussed previously, the ways to restore sinus rhythm really deal with two ways. Either electrical cardioversion, where we actually shock the individual and put their heart back into rhythm, or through antiarrhythmic medications, such as Multac, amiodarone, Sotalol, and many others. So, if you want to know maybe if you've had bouts of atrial fibrillation, one of the things you can look for is a resting heart rate greater than 100, an irregular palpitation or an irregular rhythm, increased fatigue, and reduced exercise capacity or chest pain. If you have any of these conditions, you may possibly have atrial fibrillation. Make an appointment to see me soon, and we'll discuss what we need to do to figure out whether or not you have atrial fibrillation. Thank you so much. And if you need to make an appointment, please dial 210-767-2549. Thanks for your time. Take care.